Hi guys, welcome to another lecture, and today we will be discussing something about the post-exposure and the pre-exposure prophylaxis in case of animal bites. Now, many of you might be working at PHC, CHC, private hospitals, so you know what to do when a child comes to you with a history of animal bite. Okay. Before I begin, I would like to request you to like, share, and subscribe to the channel if you haven't already. And we have launched our brand new website. The link is in description below. Please make sure that you check out the website. And also, you can download our app. You follow me on the Instagram, social media, all that, so that you can be updated. Now also I have, WhatsApp groups going on, so you can join them where I discuss at least 4 or 5 questions every day. So first thing is, firstly, a patient comes to you. Patient comes to you with dog bite. Okay, with dog bite. Okay, patient comes to you with dog bite. So ideally, what are the recommendations that how the dog should be vaccinated? So IAP recommends that the dog, if you are having a pet dog, then the pet dog should be vaccinated at 10 weeks of age, then at 14 weeks of age, and then yearly the dog should be vaccinated. So the pet dog should be vaccinated as per the schedule that I have shown you. Okay. Now, once the patient comes to you, a patient comes to you again. So a patient came, and so what first thing you should do? So first, you have to wash with ample water. Wash with ample water, free flowing water for at least 10 minutes. Okay, with soap and water, which removes at least 90% of the virus. Okay, the statistics are given by IAP. Soap removes at least 90% of the virus. Soap and water will remove the 90% of the virus. And betadine should be used. Okay, betadine is the best option. Wash with betadine, or if you are doing dressing, use betadine. Ideally, see, the recommendations are like that you do not do dressings, or you do not close up the the wound that you have. But if the wound is severe and gaping, you will have to put on stitches, or you will have to put on dressings. So depending upon the patient, see, ideally in patients in whom it is absolutely required, you go for stitches, you go for dressing. But in those who not required, or those who can let go, or you do not have absolute requirement of using this too, do not use it. Okay, so this is the first thing. Now, once you have done this, you ask the patient about the exposure. Okay, you ask the patient about the exposure. Okay, so as you know, there are 3 common categories that I will be discussing with you. 1, 2, 3. Okay, so first is touching and licking. Touching and licking on intact skin. Intact skin. Okay. Next is nibbling or scratches without bleeding. Okay, without bleeding. There is nibbling or scratches on damaged skin, or there is scratches which debride, or it breaks the skin. There is break in the continuity of skin, but there is no bleeding. And third is that there are multiple transdermal bites or scratches on a broken skin. Or you have a broken skin. Your broken skin comes in contact with the saliva of the dog. So this is very, very important, that if any of these, like these 3 are the classes, or the categories. Now, in these patients, you have to give post-exposure prophylaxis. So in first, again, on the intact skin, touching and licking, if the reliable history is there, do not do anything. Because see, what happens is, the issue in India is, or even in foreign countries, is that the child is playing with the dog, and the dog bites, or scratches the child. Now the child is afraid of injection. The child is 4 or 5 years old. He understands injection. He knows that he'll have to get a injection, so he'll not tell his parents. Okay, there is some issue, and when the parents are helping the child bathe or change clothes, that is when they notice, there are some scratches over here. So this is very important, that firstly, many children hide, and obviously they are mischievous, they are notorious, and they go and they pull the dog's tail and ears, and obviously dogs get provoked with that. And obviously they are smaller in size, so they have more severe exposure. Like imagine the rabies virus ascends through the spinal cord. What happens is the child is small, so the distance is lesser. Plus, we as a adult, we are a threat. Like we are bigger in size, so dogs are comparatively afraid of us. But children are smaller, and again, the closer the bite is to the CNS, earlier are the symptoms. So ideally, the incubation period is 9 to 90 days. 9 to 90 days. Okay. For rabies, the incubation period is this. Okay. So closer the bite is to the CNS, earlier the symptoms develop. Okay, because the rabies virus transports upwards. Second is that, okay, you have nibbling and scratches without bleeding. Okay, so give anti-rabies vaccine, ARV aap de do, and you do the wound cleaning, wound management. Okay, and if there are transdermal bite, you give IG, immunoglobulin, you give ARV, and you do wound management. Now, first thing is that there are two things that I would like to bring to your attention. So first is, okay, if the child is having child had a bite before, and ARV full course was given to the child less than 3 months ago. Okay, so if that child comes to you again, when the patient had a history of ARV full course 3 months ago, do not give ARV. There is no need of ARV, because see, obviously the patient is immune. Okay, ARV recently, obviously the immunity will be there after 3 months, up to 3 months. Okay, now if ARV full course is given to the patient previously, okay, for before, it has been more than 3 months for that. Okay, so give 2-dose ARV. 2-dose ARV. Do not give the entire full schedule. Give 2-dose ARV, day 0 and day 3. Okay. And the first thing is that we are here when we manage that. There are, when we talk that there is transdermal bite, scratches, or the saliva of dog comes in exposure, and we give IG, immunoglobulin, to the patient. This immunoglobulin is to be given only once per lifetime. Once per lifetime. You do not need immunoglobulins again and again, because see, obviously our body will have the immune response. The ARV is enough to stimulate our slumbering but ready immune system into action whenever it is needed. So immunoglobulin, you only give it once in the life. Okay, ek bar, if he has a history that he has taken immunoglobulin 5 years ago, there is no need. Give only ARV full course. Okay, or if ARV, the patient has taken 5 ARV, the second time the ARV is, you only have to take only 2 injections. So this is important. Next is TT. Obviously, you have to give depending upon the vaccination status. You know the TT ka guideline also. So TT is an entirely different story. Now, once this is out, okay, there are some other facts that I want to tell. So first one is that there is, theoretically, the human saliva has the rabies, but there is no human to human transmission documented ever. Okay, no human to human transmission documented ever. Okay, though theoretically saliva has the antibodies, when one human bites the other human, there has been 0 case yet in documentation of this. Second is I was working in a rural area and I got a patient. Hamari bhais was bitten by a rabid dog. She died, but before she died, we had drank her milk. So obviously, the rabies transmission is not possible by GI route, because the acid destroys the virus absolutely. Okay, not possible by GI route. Okay, so firstly, GI route se possible nahi hai. Obviously, they were adamant, so I had to give them, but obviously it is not required. So this is the second thing that you should understand. Okay, so this is about the rabies classification, and this is how you need to manage. Obviously, immunoglobulins are of 2 types. Okay, One is equine IG, and the next is human IG. Equine IG is relatively cheaper. Dose is 40 IU per kg, and human immunoglobulin is half dose, 20 IU per kg. The vaccine that you are giving is to be given either intramuscular or it should be given as intradermal. Okay, intradermal or intramuscular. There are two routes. You can give intramuscular, you can give intradermal. So what is the difference between the vaccines that are given by intradermal or intramuscular? So theoretically, see, what was that is that, in the intradermal mode, the thing is that, the antigen presenting cells are there, the dendritic cells are there. So the advantage is that, it has a higher response. Theoretically, it has been found that it has a better and higher response. Okay, so this is how you can go for it. Now, what are the schedules that you can give to the patient? Okay, so you in intramuscular you have a 5-dose schedule. 5-dose schedule, you all know the 5-dose schedule. And intradermal, you can go with 4-dose schedule. The dosing is 0.5 ml for intramuscular and 0.2 ml for intradermal. So it is lesser dose for intradermal. So obviously it is very, very much beneficial. And in Indian guidelines, they yet say if you are giving intradermal, give 5-dose schedule. But CDC also says, the dog bit you. After 10 days, if you see the dog, like if the dog is alive and well, you can take the dose of 14th day and you can skip the 28th day wala dose. See, IAP recommends see, in India, the more commoner bites are by the stray dogs or the mongrels. Okay, and see, it is very difficult. See, I was also bitten a couple of days before, and that is why I know all this. So I could, there are 10 dogs running behind me. I do not know which dog bit me, and even if I know, all of them nearly look similar. The mongrels 10, and in the dark night, obviously you cannot differentiate. So ideally they say कि भाई अगर आपका you have you are sure that it is this dog and he is alive after 10 days, it is fine. But see, it is very difficult to be sure, and obviously mongrels you cannot trace. Okay, so this is important. Okay, so this is important. So once you have understood this, there are other guys. See, patients will come to you, okay, bhai, a pet dog bit me. A pet dog bit me. Okay, so firstly, IAP and CDC both state that, see, vaccination of dogs is not equivalent to their immunity to rabies. Okay, see, obviously, no vaccination provides 100% immunity towards the disease. Obviously, we have eliminated polio, eradicated, variants of polio, eradicated smallpox. But see, in dogs, if you have given the full dose of vaccination, it does not equal, it is not equal to the development of immunity. And sometimes immunity may wane over time. Immunity may decrease over time. Immunity, takes time to develop. So you have, imagine that you have vaccinated the child today, vaccinated the dog today, and tomorrow the dog bites the child. So obviously it takes time. So that you need to understand. It takes time, and the vaccines that are available are PCECV. Okay, purified chick embryo vaccine, or it might be the most common is purified virocell. Okay, so virocell is used. And what are the schedule? Okay, I'll tell you the schedule only. So intramuscular, you have to give on 0, 3, 7, 14, 28. Okay, and in intradermal, if you are giving, you give 0.1 ml on 2 sites. So the dose comes out to be 0.2 ml, as I told you, and you have to give it on 0, 3. Okay, 0, 3, 7, and 28. No need for the dose, 14th day dose. Okay, so this is important. Now, once this has, you have understood about this, you have to understand that the immunoglobulin can be also given local, and infiltration is to be given, and after infiltration you can if the area is full, like where the dog is bit, the area is infiltrated completely, then you can give the rest via the intramuscular route. So this is about the rabies. Obviously in the rabies there is a Milwaukee protocol. It is not a short protocol, but yet there are documents that 3-4 people have survived the full-blown rabies, though still it is considered as universally fatal. So that is why please take care, and I hope you learned something new today, and I'll see you in the next one.